Welcome back. We've been having a wonderful conversation with Budge Brown and Jane Richens. Right now I'd like to introduce to you and have you please join me in welcoming the medical director of Eisenhower Schnitzer Novak Breast Center, Dr. Leora Lanzkowsky. Hey, ladies. Hugs are a good thing, see? Come on through here. I think that welcome.
Thank you very much for having me.
Well, you're welcome. I think you two coordinated outfits. Pretty blue. That's TV blue. That's a good thing.
That's the power shirt.
That's right.
Just sitting and listening to your stories was very striking to me. They're both not very pleasant stories for a doctor to hear. Right. One in the way Jane was spoken to. And we know that was several years ago, and luckily we've made huge strides in educating medical professionals, and just the breast center kind of has changed our whole way. We have a nurse navigator who takes a patient from the initial callback from their screening mammogram to if they need a biopsy, and there's always that one person they can ask questions to.
So they have one person that's assigned to them.
Right.
At this specific cancer center.
That's right. An educated nurse professional it's a nurse navigator and helps you through the system. If you end up with a positive diagnosis of breast cancer, that same nurse will help you to make appointments with the radiation oncologist, medical oncologist.
What is the protocol for the initial telling someone? What is the protocol? Do you call them in? Do you tell them on the phone? What do you do?
Well, you know, everything is always in flux because we're always trying to do better.
Right.
So in the past, what we've done is the negative biopsies are called and told, you're negative, you're fine, you know.
Right.
That's great. The positives we do call and speak to, but we speak to extensively about, you know, the size, what it means.
Right.
Usually we don't have the progesterone estrogen receptor markers back yet.
Right.
So, you know, anything we know, we can talk to them about. The reason we weren't calling them in is because we didn't want to waste any of we didn't want to have any time lag, because so much more needs to be done. When a woman gets a diagnosis of breast cancer now, she needs an MRI.
An MRI?
Of the breast.
Okay.
Of the breasts. And I'll tell you why that is. And she needs to make an appointment to see a surgeon, a radiation oncologist, a medical oncologist. So there's so much that goes into it. We've just changed the protocol, and we are going to call every woman in to speak to them in person.
That's wonderful.
With the nurse navigator.
Wouldn't that make you feel better?
That's really good. That's great news.
And that the nurse navigator will be in the room with the doctor when we give the diagnosis of breast cancer.
Okay.
Now, I have to do this 3-4 times a week. We have to give out a diagnosis of breast cancer. So it's something that we do pretty frequently.
Right. Right, and I have several friends that are being treated over at the center,
right.
And they feel very comfortable. They feel very warm about it. I mean, as warm as you can feel, right. But they feel like they're getting tremendous care. Now, Jane, I found this interesting and Budge, before the show, I was talking with the doctor, and she was saying that there are a mammogram is not sufficient anymore, and I didn't know that. You knew this?
Well,
did you? Yeah.
I found my own lump myself. I found it myself.
There are a few things. One thing is, just on Jane's story, is if a patient comes in and tells us they feel a lump, then we take that with the utmost seriousness.
Right.
Because if their physician feels it, well, their physician's not as accustomed to feeling their breasts.
Right.
We do take it seriously, but if the physician feels it and the patient says, you know, I've had that forever, whereas if a patient comes in and said, my doctor doesn't feel it, but I feel it, it's different, I think something's going on, we take that extremely seriously.
Wow.
And we won't stop until we get, again, advanced imaging to figure out what's going on there. Because sometimes women do feel it, and you know, you'll hear stories like that where they haven't been taken seriously and diagnosis.
And what are some of the symptoms? I know because the cancer starts in the breast ducts, doesn't it?
Right. It can start in the ducts, in the milk ducts. The way the breast is formed, it's fat which surrounds the gland tissue that produces the milk, and then it goes into ducts that leave through the nipple. And cancer can form in any parts of the breast. They can form even in the fat. They can form in the glands, and that's usually a lobular type of cancer, or a ductal type of cancer.
And there's a C2, is it CITO, S-I-T-O? There's two different kinds of cancer?
In situ.
Situ.
Ductal carcinoma in situ,
Yeah.
that's right, which is the very earliest cancer we can find in the ducts of the breast. And then the same type of cancer, which when it goes and explodes kind of out of the ducts of the breast, and that's the type of cancer that can then go to the lymph nodes or metastasize. And
those are the ones you treat more aggressively.
right. Now, a few things. Firstly, we were talking about how mammography may not be sufficient. Now, I don't want to give the wrong idea about that,
Right.
because mammography is extremely important, and we've shown that women are surviving cancer because we're detecting breast cancers early, and the majority of those women, the reason is because of the early detection of breast cancer before lymph nodes have become involved. And that's
Okay.
extremely important. But we find that with mammography, we sometimes, in certain women, it's not as good. So like, if a woman is very thin and has no body fat and has a very dense breast or is very young, and Jane, I'm sure, fit into this category, that I haven't seen her mammogram.
You did.
Yes, I did.
Extremely dense breasts. And the problem with that is that we are definitely not going to pick up cancer in as much as 50% of the time in a dense breast.
But they found, thank God they found yours. And you had it nowhere else.
No, I did not.
Thank God.
But
Thank God. Now, you said that there are more, you're going to be tailoring in the future?
yes.
So you're not going to have to be taking all the poisons necessarily, as you were saying, Budge, which I think that's interesting as well.
Well, in most places, and if you look at the website now and you look at the stories of 8 different women, you know, cut, burn, and poison seems to be the protocol across the United States with no variation. And hopefully, Sloan Kettering just came out with another protocol and pinpointing one of the major dangers of breast cancer, and that's sugar.
Wow.
And of course, one Coke is 46 grams of sugar.
One
and
Coke, wow.
evidently, the cancer feeds on sugar. So the news media and its expertise came out against alcohol. But I don't know how many gallons of wine you'd have to drink to get the same amount of sugar in one can of Coke.
Isn't that amazing?
So it's interesting that there's things out there that women can do to protect themselves that they don't know about.
Right.
And that's kind of what our goal is, to try and get articles
More
from
awareness,
you,
right.
from other doctors that have expressed an interest in writing for our Choices column.
So you become a resource.
Yeah.
Maybe the two of you can connect, and you can lend some support as far as
I'd like to
new,
provide
innovative,
a place, yeah. You know, whether it's
innovative types
I think
of
that-
less
I think that
invasive
diet's
types
important.
of treatment.
I think the diet is important.
I do too. I would think it is. And in different ethnicities, do you find cancer in different, like African American compared to Caucasian to Asian, different levels of cancer?
Yeah, the Caucasian women have the highest rate of developing breast cancer, but the sad news is that when an African American woman or a Hispanic woman develops a breast cancer, it's often very aggressive, and their prognosis is not as good. So, you know, there's a kind of a different balance. But with Budge's, I just want to say also with his generosity, this is what helps us so much in the medical
Right.
field, because especially with insurance reimbursements, various things, we depend so much on the generosity of donations. And through that, we can get some of the newest technologies and really save lives.
And this way, we will be able to, if not totally, but do the best we can to eradicate breast cancer. Thank you all for sharing your stories. God bless you. God bless you, and you as well for all you're doing, Budge. Every week we give out an award called the Random Act of Kindness Award, and that goes to an individual that goes far beyond the call of duty in their lives. And you certainly, certainly deserve this. So you are going to receive the Random Act of Kindness Award this week, and also there is a certificate for PS Flower Mart for a bouquet of flowers. And we give this to you with our heart. And thank you very, very much for being here. Go to... Thank you. Make sure you go to cleavagecreek.com to get more information on the survivors and how you too could possibly be one of the ladies on the bottle within the next year.